Hey guys, thanks for joining me today. I have some information that I think you as pet owners really need to know before you schedule your parent or your pet's next vaccines. The title of my video today is Your Pet's Vaccines, what you need to know before you schedule that appointment. First of all, we have to remember that vaccines are not just shots. They're injections of many different components in that little vial that goes into your pet's body. So we have to remember that a vaccine is a medical procedure. A vaccination, I should say, is a medical procedure and should be treated as such. So first of all, I'm just going to say, I'm going to go over some benefits of vaccines. I'll go over the risks of vaccines and then how we determine how to weigh the benefits versus the risks. First of all, in human medicine, if you go in for a vaccine, the assistant will probably, or the nurse will hand you, or you'll be able to read on a computer screen or whatever, what they call a VIS. This is a vaccine information statement. Basically, that VIS is required by law. Your doctor has to provide it to you before you consent to a vaccine. And in that VIS, they spell out all the information, all the details about each disease, how it's contracted, what it does to the body, that kind of thing. And then they'll talk about the vaccine for that disease as far as what the risks are, the side effects, the adverse reactions that can happen with that. And then you as the patient can either decline the vaccine or go ahead and accept it. You actually don't even have to read it. You can decline to read it, but that's there for a purpose so that you understand there are inherent risks behind a vaccination. Now, do veterinary clinics provide this to their clients? No. I hadn't even heard of a VIS because I don't get vaccinated myself. So I've never heard of this vaccine information statement. I think it's a wonderful idea, but I don't understand why the veterinary community does not adopt this. Because let me just say, if I had your dog or your kitty as a patient of mine and you wanted to get the rabies vaccine and probably the distemper and the other vaccines that both species need, I'm going to sit down, especially if you have an animal with some health issues, or if it's an older animal that's had many vaccines in the past. I'm going to go over those risks versus the benefits with you and see, based on your pet's lifestyle, what it does, what it eats, where it goes, that kind of thing. Does it actually need to have all these vaccines that come on that little reminder card that you get in the mail, that you don't even know what those things are? If it says DA2 PPV for your dog, you probably don't have any clue what that is. That's actually the distemper, adenovirus, parainfluenza, and parvovirus shot, combination shot. But a lot of the other times, if you get an FVRCP for your kitty and it says that on the card, you have no idea what that is. So you can look it up, but a lot of people just accept that. They got the card in the mail. I guess my dog or kitty needs all these things. I have had to, actually inform some of my patients. I work at actually right now, most of my business is through consulting. I do telemedicine consulting with people who want a holistic or a natural approach to their pet's health. And I can do that for people all over the country. And I do that on a regular basis. I love what I do because I can give second opinions. If I've got the, the medical records, I can go over those with you. I can go over the products, the diet that your dog or kitty is taking. And I scrutinize everything. I mean, I'm one of those investigative type of veterinarians that wants to know everything, because health is not just a symptom. We don't just treat symptoms, or we should not just be treating symptoms. We should be getting to the root cause of disease. I'm going down a little bit of a rabbit trail here, but anyway, going back to the vaccination issue. If you bring your kitty into me, you bring your dog into me, I'm going to sit down and say, is your kitty an indoor kitty? Does it go outside? Does it mingle with other kitties? Or maybe it's a barn cat that's exposed to a lot of different things. Same way with the client I had at a conventional clinic that I fill in for, because that clinic will let me do my holistic treatments there. And they're very good about letting me discern what I can and can't, or what I feel I should or should not do with an animal as far as, say, like the vaccines and diet and that kind of thing. But it was an older lady, and she lives by herself, and she brought in her 10-year-old, beautiful, sweetest little long-haired Chihuahua, and only 6 years of age. But she brought in the reminder card, and she says, I'm going to catch, what was the dog's name? Chula, I think. You want to catch Chula up on everything that she needs. Well, the card said it needed rabies, the distemper, adenovirus, parvo, parainfluenza, combination vaccine, Lyme disease, and then kennel cough. And I'm looking at the little dog, it's 9.8 pounds, and I really do not want to put all those things in all at one time. So after I started questioning her, I said, what is Chula's exposure to Lyme? Is she out? Did you take her to the dog park? You go camping with her? She goes, oh no, she never goes outside. She actually potties on a pee pad in the house. I said, she never goes outside, not even to sit on the deck or anything. Oh no, she's just always indoors. You don't take her grooming, you don't take her to a boarding facility. Nope, never do. So I kind of looked at her and I said, I can't tell people to not vaccinate. I can just say, if it were my animal, based on what you've just told me, she can't get sick if she's not exposed to other dogs or wildlife. I said, there's really nothing that she really needs as far as a vaccine. Now, granted, this little dog had a heart condition also and chronic ear infections. And I knew that if I started vaccinating this dog, it was probably going to make those two issues a little bit worse. And so here's what I mean by risk of exposure versus the benefits and the risks of adverse reactions. And I said to her, since your little girl is not going outside, she has virtually zero chance of contracting any of the diseases that we're vaccinating against. Do you still want to vaccinate her? And she kind of looked at me like, well, I've never been told that before. I said, of course you haven't. Because I said, the clinic doesn't work that way. And I kind of left it at that because I don't want to get in trouble. I don't want to, every clinic has their protocols. But here again, this is what I mean by sitting down with the client or the pet owner and saying, do we really need to do this? You're probably asking me right now, well, why don't you just vaccinate? What's it going to hurt? I will get into that in just a few minutes. So the other thing was that she wanted the year's amount of flea and tick and heartworm product. And I said to the owner, she's not going outside. Do you have other animals at home? No, she's my only one. I said, why would you do heartworm when she never goes outside? She goes, I never thought of it. She says, I was just told I needed to be on a year-round heartworm prevention. If she has no exposure to mosquitoes, now your vet clinics will try to tell you, they'll try to scare you. And I've been there, done that before before I was into holistic medicine. I was convinced that if one mosquito came through the screen and into the house, that she could, there could be a heartworm infection. I mean, sure. I mean, anything is possible, but it's not very probable at all. And so if we load this dog up with an ivermectin or an isoxazolazine type of drug for 12 months out of the year, or she opts for the 3-month flea and tick pill, it's just like, here are those chemicals loading up that body and they're sitting in there. And it's the cumulative effect of all of these chemicals that cause problems later on for this dog's life. Who's to say that the heart issue, I mean, it could be a genetic issue. We don't know what caused the heart issue, but her chronic ear infections, anytime we load the body up with toxins that are not necessary and that can't be gotten rid of easily, that causes problems. Now, I promise you I'm talking about vaccines, but I just had to use that as an example. She's thinking that this little dog who stays inside and never goes out has to have all these things. So in the end, she opted to do nothing. And that was really good. I talked her into a little bit better diet, and then to, also add some supplements to support that heart muscle so that her little dog didn't have to, have such a progression in the heart failure. Flip side of this now is we've got the working dog, we've got the Labrador hunter, we've got the bird retrieving Labrador that's in stagnant ponds or lakes and exposed to a lot of different types of wildlife, or you've got the coonhound goes out and hunts raccoons and kills raccoons. That's a different story. Now, that dog probably needs to be vaccinated, actually does need to be vaccinated for rabies. And it also has to be vaccinated perhaps for leptospirosis, because lepto is a bacterium type of organism that is carried by different types of wildlife. And it's found a lot in swamps and stagnant ponds and lakes. So if dogs tromping through that type of environment, it may need that. So there are what we call core vaccines and non-core vaccines. Now, core vaccines would be things that every dog or every kitty would be exposed to. So I'll just use dogs for an example. Core vaccines in dogs is the distemper vaccine, the parvovirus vaccine, the adenovirus vaccine, and then the rabies. And rabies is required by law in all 50 states. So it's one we can't really get around very easily at all. So the non-core would be Lyme, could Bordetella, which is kennel cough, canine influenza. Which one am I forgetting here? Non-core vaccines would be any vaccine, depending on what part of the country you live in. You might get a rattlesnake venom vaccine or anti-venom vaccine. But these are vaccines that not every dog is going to be exposed to. So when we're talking with the client, we have to think, what part of the country are we in? Are we around a lot of mosquitoes year round where we may need some extra protection? Are we in a dry climate where bugs aren't really an issue? Are we doing things? Are we taking our dogs to dog shows where there is a lot of influenza going around? It's just like we have to look at that. Why is it important? Why am I talking about all this? Because why don't we just vaccinate, right? Okay. What you guys probably do not know is that there are up to 22 different components in both human vaccines and animal vaccines. If we could just take the killed or the attenuated means it's been modified so it can't cause disease, but it still has a life force to it. If we take that virus that has been attenuated or killed and put it with sterile saline and inject it into the body, I don't think I'd have a problem with that. I see very little problem with that. But most vaccines, they have to have an adjuvant, which is a strengthening agent. Usually it's aluminum hydroxide or some kind of aluminum salt that goes in that vaccine to make the body have a stronger immune response to the antigen that is in the vaccine. That's one thing. And adjuvants cause a lot of issues. Other adjuvants are oil-based squalene, bacterial-based lipopolysaccharides, and sugars. Other things that we find in our vaccines are preservatives, and the most common one is thimerosal, which is a derivative of mercury. And everybody should know that mercury is extremely toxic to the body. Antibiotics like gentamicin, amphotericin B, neomycin, polymyxin B, and a preservative called phenoxyethanol. So now we have an ethanol product, an alcohol product in the body as well. Then we have growth mediums. That's what the vaccine is made from. That's usually foreign animal tissues like chick embryo, cow serum, monkey kidney tissue, pig tissue. Ooh, and this one I hate to even bring up, but I have to. Human fetal lung tissue. And that comes from aborted human babies. Other products you'll find that I have no idea why they are added is are insect proteins, stabilizers, contaminants like glyphosate from GMO-fed animals. That's used for the growth medium. Fungicides and antimicrobials, as, oh gosh, even formaldehyde in here. Formaldehyde can be used as an antimicrobial, but it also can be used as a stabilizer in the vaccine. And for those of you who don't know what formaldehyde is, it's embalming fluid. Formaldehyde is like if I would take a tumor off of a pet and want to preserve it to send it into the pathology lab, I drop that tumor tissue into a little vial of formaldehyde. We don't ever want to get this in our skin. We wear gloves when we're handling formaldehyde. Sometimes we even use masks so we're not breathing it in, but that's being injected. It's being injected into our animals. Okay, so if we go back to the adjuvants, these are the things that cause most reactions. So there is no biosystem that uses a heavy metal aluminum, none. But once aluminum is in the body, it's very difficult to get rid of, like I mentioned earlier. So the aluminum adjuvants tend to turn on the immune system, kind of like overkill. And it's done in a very non-selective, non-specific way, making that immunity last longer. That's what aluminum is supposed to do. But after the aluminum causes damage locally, it goes to the brain, spleen, muscles, bones, liver, and the heart. And this is where it stimulates the immune system by presenting the virus antigen particles over and over again. So it acts as an antigen in itself, stimulating the immune system to stay turned on for a very long time. Now, this whole process has an acronym, and that acronym is ASIA. ASIA stands for Autoimmune Inflammatory Syndrome Induced by Adjuvants. Honestly, this is the first time I've heard of this. This came off of dogsnaturallymagazine.com's website. This information is suppressed in mainstream. And this is why I encourage my clients and my consulting people to really dig deep. Don't just take my word for it, do your own research, because you'll be shocked at what is allowed in these vaccinations, and that the adverse reactions are oftentimes very much suppressed. Okay, so we've gone over that. So what do we do? What do we do if we don't want to vaccinate? Like I mentioned, with rabies, it's really difficult to get around. There are 17 or 18 states in the United States that will allow a medical exemption. And let me back up by saying that when a veterinarian gets a vial or tray of the 50, like say you order a tray of distemper, adenovirus, parvovirus, parainfluenza combination vaccines, on the vaccine insert, it says that that vaccination or that vaccine is for immunization of healthy animals only. That does not include animals that have allergies, other autoimmune conditions, kidney failure, inflammatory bowel disease, cancer, you name it. If it has a chronic disease, it shouldn't be vaccinated. Yet, have you tried to get your dog to a boarding facility or a grooming facility without a vaccine certificate? It's really difficult. It can be done though. And I write a lot of medical exemptions. I have to examine the animal in person, but once I determine that there is a true issue, then I can write a medical exemption saying that it would be detrimental for this pet to have vaccinations. And basically then it's up to the grooming facility or boarding facility or wherever to accept that exemption or not. Fortunately, a lot of these larger towns and cities now have mobile groomers where you would not have to present papers for vaccinations. You can hire pet sitters to come into your home rather than going to, say, like a vet clinic or a boarding facility where you have to have Bordetella, rabies, and distemper combination, sometimes other things too. So those are some of your options. If you are forced to vaccinate your animal, because like in Iowa where I live, we have no exemptions. They're not recognized. That's up to the pet owner at that point to say, well, I'm not getting my pet vaccinated. That's your choice. However, if your dog or kitty bites somebody or nips them and breaks the skin and there's no current vaccine record available, then you're liable. And that most cities around here in my area will force you to, I shouldn't say force you, but kind of is forcing, mandating you that you quarantine your animal at home for 21 days, and then you go back into the veterinary clinic at 21 days or shortly thereafter to get a health checkup. Everything looks good, then you're released. Worst case scenario, they could order your animal to be euthanized and with the head sent into a testing facility to check for rabies. So that's where I say, I have to draw the line. Now it's up to you guys. You have to decide. Excuse me. Other things that you can do if you have to vaccinate for anything and you feel strongly against it is you can purchase homeopathic remedies. There are many good ones out there. The one that I use most often is called Thuja, Thuja 30C. And basically it'll come in a little vial that says 4 words. Well, it's because the FDA requires some kind of recommendation, I guess, on that. And they can't say for liver detoxification, but that's actually what it's for. Thuja 30C. And I have not been able to find for rabies, there's a really good homeopathic remedy called Lyssin. It's Lyssin. I've not been able to find that. I don't know if that's been completely pulled off of all markets or not, but there are other things that you can do to detoxify your animal, do a good cleansing detox after that. A lot of times I will use essential oils to raise the frequency of the body after vaccination, along with a good diet, stress reduction, everything that you should be doing anyway. Okay, titer testing. I have not gone over that yet. This is really a cool way to determine if your animal is immunized or not against a certain disease. For example, we could run a distemper and a parvo titer. Now that's a blood test that is done usually in the veterinary clinic. Take a blood sample and they can either do what they call a rapid test, which is a yes/no test, or they can send it off to a lab for a quantitative assay. So big mouthfuls of words here. Quantitative assay means that laboratory that you send the blood sample off can give you an actual number of circulating antibodies against that disease. And if there are antibodies, we know that your pet's protected. The other test that's run in clinic and doesn't have to be sent out to a laboratory is run in about 20 minutes. And basically that checks for if the animal's high on their numbers or low on their numbers. It's kind of like a color change. So there's a control dot in the center of the test. And then if the animal has more antibodies than we expect, it'll have a darker color change on one side. If the levels of antibodies are falling on the other side, then that color change will be lighter. And then you could say, well, I guess, yeah, we need to rebooster. We could determine if it's wise to rebooster that vaccine or not. Or we could send in to the lab and get a quantitative number. If there is no vaccine titer, let's say that the animal tanks out on our immune system and they're not producing any antibodies, that's of concern, and that animal most likely should be revaccinated. There are some dogs genetically not programmed to respond to a vaccine, but they will respond to the actual disease if they get it. And sometimes we call that natural challenge. And if they mount a good response to that natural exposure, hey, that's perfect. That's actually the best way. All right, I'm just trying to think of anything else here I need to go over. It seems like, so if we have a reaction to a vaccine, if our animals have a reaction to a vaccine, what might we expect to see? Well, the mildest reaction would be like soreness over the injection area, where your pet, maybe you've got a little dog, he got an injection in the shoulder. He's a little ouchy, little whimpery when you touch him. That's what probably the least amount of reaction to expect. Some dogs will get, and cats too, will get a whole body soreness where they're just, you touch them and they're whining. Maybe they'll try to nip you because it hurts. Maybe they'll be shaking a little bit from the pain too. They might sleep more than normal. GI issues like vomiting and diarrhea, that usually happens with cats more than dogs, but it can happen with both species. Your kitty or dog might run a mild fever and just be off for a few days. Maybe they're just not as hungry as they should be, not drinking enough water. Any of these, I don't care how mild it seems, you should report this to your veterinarian so that they can mark that in their record. And any future vaccines that have to be given will be pre-treated with an anti-inflammatory or an antihistamine, or sometimes both, depending on the severity of the reaction that they had. In my opinion, if an animal's had a severe reaction, they should never get another vaccine. That's just my personal and professional opinion, because once they have a reaction, it can happen worse the second time. And I am a vaccine reactor myself. You heard me say earlier in this presentation that I don't get vaccinated. That is my purpose, because I have had a very severe reaction to a vaccine, and I will not do that again. My life depends on that, not getting vaccinated. So some of the more serious symptoms that you will see within minutes or even hours, it's usually minutes to an hour after a vaccine. Swelling of the face and the eyelids. This is a huge concern because this can progress into difficulty with breathing. So if your dog or kitty is having trouble breathing, emergency situation, you need to be calling your veterinarian and getting that pet back there ASAP. Intense itching, that's another sign. Or if your kitty or dog breaks out in hives and is intensely itching, that is a huge concern. The worst case scenario is if your dog or cat has a seizure, collapses, and maybe quits breathing. That's happened. Unfortunately, it doesn't happen very often. I'm going to say fortunately, it doesn't happen very often. But if that's not taken care of, it can progress into death. I hate to say that, but animals have died after vaccines. And this is why I bring this to light, is to all the things that are in the vaccines that you're putting in that you're not putting in, your veterinarian is putting into your animal. This has to be an informed consent, or at least the vaccine information statement must be gone over. And if your veterinarian is pushing you or pressuring you or bullying you into vaccinating your animal when you don't feel it's right, I say find another veterinarian. There's nothing, you know your animal better than anyone else. Your veterinarian sees your pet maybe twice a year, if that. He or she can't begin to know your animal and know its quirks. And you have the emotional attachment that your veterinarian does not have to your animal. So my closing statements here would be to absolutely make sure that you feel comfortable doing what you're doing with your pets. And if you have any questions, my contact information, right now I'm rebuilding my website. So it is very bare right now. There are some online courses listed there, and my contact information. Not a lot of, there's no text right now because I'm like trying to do everything over again. But you can contact me. My phone number is 563-380-0983. My email is drbfox, like Dr. B Fox, at yahoo.com. And my website is barbfoxdvm.com. So I hope that this has helped you sort through some things and maybe shake up a little something in your thought process behind just doing the perfunctory or just going ahead without discernment on that reminder card. And talk to your veterinarian. And again, if your veterinarian won't listen, find somebody who will. All right. Thank you. Love on your animals. Take care, guys. Bye-bye.